Very glad to be here. Thank you for that kind introduction. I had the pleasure of being appointed by Governor DeSantis in January after spending about a year and a half in the agency to be secretary. It was confirmed this past legislative session. Huge honor for me and my family. We moved our 4 small young children down from the New England area about 2 years ago. We're very happy to call Florida our home now. Absolutely love it, and I'm glad to be working in this role. I'm fortunate in so many ways, one of which is the great sister agencies that we have here in the state of Florida. I work very closely with the Department of Children and Families, with Secretary Harris, with the Florida Department of Health, with the Surgeon General, Dr. Joe Latipo, and the Department of Elder Affairs with Secretary Branham. Great, innovative leaders that care a lot about healthcare in the state. I'm glad to be an agency head along with them. So I wanted to talk just very briefly. I know that the main attraction is Kim, and I don't want to stand between you and Kim for too long here. But I did, since I was asked to speak, feel obligated to tell you a little bit about some of the governor's priorities and the agency's priorities as well. So the governor has, along with the First Lady, a very bold vision for Florida's healthcare system. We often talk about it in 3 prongs. 1, high quality, 2, transparency, and 3 is cost-effective care. And these kind of are the overarching principles by which we make daily decisions. And some of the ways that those elements have manifested themselves in the decisions that we've made are, for example, the governor and the First Lady, the agency's support of motherhood and fatherhood. We think that strong parents are crucial to ensuring that children throughout the state thrive. The governor's very focused, and the First Lady as well, on being a leader in the fight to cure cancer. And the governor has also championed transparency initiatives and seeks to eliminate barriers that hardworking Floridians previously faced, ensuring better care. This past year, you've probably seen some of the governor's priorities at work with our response to some of the abuses by the pharmacy benefit managers. Last year, the governor promulgated an executive order that allowed the agency and other state agencies to take actions to address some of those abuses. But also this past legislative session, a lot of the pieces of that executive order were codified in statute. It was a heavy lift, but it was something that was very important. The agency was very happy to work along with the bill sponsors to make sure that the state imposed some transparency obligations into the pharmacy benefit manager space. We're very happy to see that the governor signed that and that those efforts are well underway. Also, and this is a little bit before that, but the governor's taken measures to enshrine the legislature as well, to enshrine the right to visit loved ones in Florida hospitals and long-term care facilities, because it is a fundamental right, we believe, for Florida families to be able to visit their loved ones who are receiving care, especially in end-of-life situations. Those are some of the governor's priorities, and our priorities at the agency, to a large extent, mirror what the governor's priorities are. So, for example, one of our big initiatives is promoting healthy birth outcomes. We think that healthy mothers, healthy babies, is critically important, especially as we think about the Florida Medicaid program. We cover approximately 50% of all births in the state, and we need to ensure that moms have the care that they need to take to make sure that they have healthy babies. One of the ways we did that was with the legislature in extending postpartum coverage for moms up to 12 months after birth. We're very happy to be able to do that. We also want to continue to support strong families by taking measures to improve childhood and adolescent mental health. I think we're long past the time where we can kind of maintain the status quo with mental and behavioral health. We need to be looking for new innovative ways to address the growing crisis in this area. It's incredibly important for all ages, but especially for our youth and adolescents. So we at the agency are committed to working with our partners to make sure that we can address that crisis. I mentioned cancer earlier. Cancer is something that the agency is very, very much focused on under the leadership, among others, with First Lady Casey DeSantis. The First Lady created this Florida Connect Collaborative and asked several people to be members of the collaborative, including myself, to spearhead ways to bring innovative cancer treatments and funding methodologies just to make sure that we are leading the fight in the United States to cure cancer. It's a very bold initiative, and there's a lot of things that we're still working on and things that need to be worked out. But I want everybody that we work with, everyone that we partner with, to be thinking about these things. If anybody here wants to get involved or has thoughts, we'd be happy to hear it. But that is one of the most important things that we're working on here in the agency. Also, we care a lot about self-sufficiency. We want people, I think people are happiest when they are at their highest and best use. And one of the programs that the First Lady has initiated over the last year or 2 years is the Hope Florida Network, which connects individuals in need to community resources that will help support them in the long term. It includes programs for families, veterans, and especially seniors, mobilizing community organizations to help, which is harnessing the goodwill of people throughout Florida to help volunteer in their communities. And there are a host of other things that the agency is working on as well, but these are just a couple of the highlights that I wanted to point out. Now, how are we going to accomplish all of these things? All of these things are an extremely heavy lift. But I think of two primary ways. And one is with the hardworking individuals we have at the agency, both at headquarters and throughout the state, in our many field offices that stretch all the way from Miami and northward throughout the state. I've had a chance to travel to a good number of these facilities, and there's just tons of great hardworking people all around the state that work in our agency that we rely on every day. And when I think of people that I rely on, the first name that comes into my mind is somebody like Kim Smoke. Now she won't tell you, but we had an award ceremony pretty recently in the agency where she was the inaugural winner of the Almanac of Expertise Award, which just I guess encapsulated in its purest form is the person you go to in situations where you really need to know an answer quick. She is a wealth of information, and I got to know Kim very well over the last 3 roles, but especially this role as secretary. The other, and so that's one, is you have to have a team with you. But at the same time, we at the agency cannot do all these things by ourselves. We just can't. So we rely on partners like the Florida Healthcare Association and their leaders like Emmett and Debbie and others to help us make healthcare better throughout Florida in this space and really more generally as well. And I just want to give you a little example of why this is important. So when I was, before this role, it was mentioned I was chief of staff for about 5 months. Week 3, I had a really busy 2 first weeks because there was a crisis in the supplemental payment program that we had to fix, and then there was the $15 minimum wage issue that we needed to address my 2nd week, and then my 3rd week as chief of staff, Hurricane Ian struck. So it was each week I was wondering if I'm going to get to the end of that week. But out of that kind of very terrible crisis situation, the silver lining was that I got to post up right next to Kim at the Emergency Operations Center for a couple of weeks and see firsthand how she operates and how she operates with all of the stakeholders in the space and all of you. And it was an incredible learning experience for me, and I learned how important associations like this are in emergency situations. I truly believe that everybody really stepped up. I mean, there's a lot of heroes that came out of that hurricane. Many of them are in this room. And so I do believe that that type of relationship between the agency and other agencies in the state, associations like this and other associations did in fact save lives, the number of which we'll probably never know. But that's why we at the agency, I can promise open lines of communication. I know that Kim already has done a very good job of meeting with as many people as want to meet with her, but it's something that's been very important since I became secretary, because I believe that those relationships are extremely important, especially in emergency situations, but also more generally. That's why I invest time coming to things like this, meeting with Emmett, Debbie, just building those relationships is extremely important. I think that you are all here very lucky to have leaders like that, that are engaged with leaders in the state, that care a lot about this space and care a lot about you and the people that you serve. I think you're all very fortunate to have that leadership team in place. But I can ensure that those relationships, as long as I'm secretary, are going to be nurtured. But without further ado, I'd like to have Kim Smoke come up here to start with her remarks. But Kim is one of those deputies where you feel you give her as much rope as she needs, and it's also very wise to listen to Kim whenever she speaks and do what she says, and I have followed that advice myself on numerous occasions. So I think it's a wise secretary that follows the advice of Kim Smoke. But without further ado, the main attraction, Kim Smoke.